Bladder 1 is located 1 fen medial and superior to the inner canthus of the eye. If a person scrunches up their eyes, a nice depression forms here, and that's where you're going to find bladder 1. Bladder 6 is 2.5 cun into the anterior hairline, 1.5 cun lateral to the anterior midline. Sanjiao 23 is located towards the lateral end of the eyebrow in a nice dip on the supraorbital margin. If you palpate towards the end of the eyebrow, on most people you'll find there's a nice cleft in the bone. To locate gallbladder 20, palpate up the groove in between the sternocleidomastoid and trapezius muscles. As you get to the base of the occiput, you will find a nice depression. Gallbladder 20 is in the centre of that depression. Do23 is located on the anterior midline, 1 cun posterior to the anterior hairline. We take the distance between the centre of the glabella and the anterior hairline as being 3 cun, so divide this into 3 to get your 1 cun to move back to locate Do23. Stomach 2 is located 1 cun inferior to a pupil looking directly forwards. To find this point, you'll need to stand directly in front of the person, palpate inferior to the pupil by about 1 cun, and you should feel a dip, which is the infraorbital foramen. Don't press too hard though, because there's a nerve here and it can be quite tender.
Kidney 12 is on the lower abdomen, level with Ren 3, half a cun lateral to the midline. Kidney 15 is on the lower abdomen, 4 cun superior to the symphysis pubis, at the level with Ren 7, half a cun lateral to the midline.
Small intestine 3 is on the ulnar aspect of the hand. It's in a depression which is proximal to the head of the 5th metacarpal. It's in between the metacarpal bone and the muscle, and it typically lays on a level with the distal palmar crease.
Large intestine 4, you're going to find the length of the 2nd metacarpal bone. So running your finger down, finding the base, making sure that you're not actually on the carpal bones themselves, finding the midpoint of that shaft of bone, coming between the 1st and 2nd metacarpals, nearer to the 2nd than the 1st in the muscle.
Lung 9 is located on the lateral aspect of the wrist flexure, in between the radius, the scaphoid, which is one of the carpal bones, the radial artery, and the tendon of abductor pollicis longus, which is this big tendon that can pull the thumb out. So find the dip between all those 3 landmarks and the radial artery and mark your point there. Bladder 58 is 7 cm directly superior to bladder 60. It's often described as being 1 cm inferior and lateral to bladder 57, but that's not always the case. Bladder 67 is the lateral nail point of the little toe. Be sure to mark it clear of the nail bed. Stomach 36 is located approximately 13 cm superior to the prominence of the lateral malleolus on the anterior border of tibialis anterior. The easiest way to find it is to palpate down the tibial tuberosity. Find the base of the tibial tuberosity and move slightly laterally until you fall into a nice dip on the anterior border of tibialis anterior. This point is also 3 cm inferior to the inferior border of the patella.